Kamala Harris Medicare for All Plan explained. Video by CBS News. Finally offers an unambiguous look at where she stands on the short answer. Her addressing this question, since private insurance would effectively be done away with under has been central to the current Democratic debate over health care, though Harris' responses have been somewhat muddled until this point. Her health care plan. In laying out her proposal, Harris notes that she supports the same end goal as Sanders, but draws some distinctions in how she would go about getting there. Unlike Sanders's, Harris' plan would include a substantive role for private insurers, which would still be able to offer plans under a tightly regulated system, similar to the way that private insurers currently do through Medicare Advantage. Additionally, experts say that Harris' approach enables her to continue supporting universal coverage, a major priority for progressives, while also making the plan a bit more politically palatable to folks who are concerned by how disruptive it could be. With a longer at the end of the 10-year transition, every American will be a part of this new Medicare system, Harris writes in a Medium post. They will get insurance. Harris' plan is very similar to Sanders's and would include many of the same benefits. It would guarantee insurance coverage for every American, and it would mean that people would not pay any out-of-pocket costs when they visit the doctor. There are, however, 3 key areas where the two plans differ. 1. Harris' plan includes a 10-year phase-in period between the current health care system and Medicare for All. As part of her plan, Harris would phase in people over the course of 10 years, instead of 4 years, as Sanders has proposed. That extra time, a 10-year transition, is wise and even a little ambitious, Georgetown University health policy professor Sabrina Corlett told Vox, pointing to challenges the Affordable Care Act faced as part of its 4-year transition period. In order to navigate this transition, the Harris plan would automatically begin enrolling newborns and uninsured people, and allow anyone who's interested to buy into Medicare immediately. It would also provide. The Harris campaign argues that an extended transition period would help reduce the costs of this change, though Corlett says this benefit not guaranteed, and that it would be dependent on a slew of variables. A shorter phase-in, though much more demanding, has its own upsides, says University of Pennsylvania health law professor Allison Hoffman. You roll it out quick. 2. Harris' plan still includes a major role for private insurers. Harris' plan addresses the recurring question of whether private insurance would be eliminated head-on. It enables private insurers to offer Medicare plans as a part of this system that adhere to strict Medicare requirements on costs and benefits. Presently, Medicare will set the rules of the road for these plans, including price and quality, and private insurance companies will play by those rules, not the other way around, she writes. This tenet is significantly different from Sanders's plan, in which private insurance would be duplicative in most instances, and only exist for a narrow set of health care needs that Medicare does not cover, such as plastic surgery. In order to ensure that private insurers do not drive up costs for consumers, Harris emphasizes that they would be heavily regulated. Essentially, Corlett says that guardrails need to be in place to ensure that private insurers aren't incentivized to solely target healthier individuals as a means of minimizing their own risk. She also notes that there will likely be trade-offs in the degree of administrative cost savings Harris' plan might see versus Sanders's. Private insurer. 3. Harris' plan would not impose an additional tax on middle-class families. Harris indicates that she agrees with many of Sanders's proposed methods for paying for Medicare for all, but argues that middle-class families should not have to bear a tax burden in order to implement the policy. Sanders has proposed a range of ways of paying for his Medicare for All plan, including higher taxes on the top 1% and taxing capital gains at the same rate as ordinary income, Harris writes. She notes that one of Senator Sanders' options is to tax households making above $29,000 an additional 4% income-based premium, she writes. I believe this hits, to make up for the loss of revenue that would result from this change. Harris proposes an additional tax on Wall Street stock, bond, and derivatives transactions. I would tax when it comes to Harris and health care. One of the biggest questions that's emerged concerns her stance on private insurance. In at least two let's eliminate all of that. Let's move on. This issue is one that's become central to the push for Medicare for all. Those who are critical, as part of Harris' plan, people could decide between public and private plans offered under Medicare. And employers could. Harris' approach is a more politically feasible way to reach Medicare for all, says Hoffman, in part because it preserves the choice that some people are wary of losing. Keeping private the negative is that you keep private insurers in the core of the program and you're siphoning off a piece of the tax money to fund the program to give to private insurance, Hoffman told Vox, noting that these companies can continue to be political actors. The record of Medicare Advantage also offers arguments in favor and against such an arrangement. Although Harris' plan also clears up her position about Medicare for all and taxes on the middle class. One of Harris' because Sanders's take on Medicare for all includes a 4% income-based premium on all households making more than $29,000. Harris' support for it had spurred questions from about whether her support for the health care plan contradicted her backing of the LIFT Act. Harris makes clear in her version of the health care bill that she intends to address this apparent conflict by eliminating any tax against households making less than $100,000. That could mean that Harris says should make up for the lost revenue created by this structure by taxing a series of financial transactions on Wall Street that her campaign estimates would bring in $2 trillion in revenue over the course of 10 years. Senator Harris is outlining clear, serious, and thoughtful proposals to finance her approach to Medicare for all, Michael Linden, an economic policy expert who works for the Hub Project, said in a statement. Her plans to much like pretty much any Democratic health care plan that's being proposed this cycle, Harris' version of Medicare for all isn't expected to obtain congressional approval anytime soon. What it does do, however, is add to the mix of more than 10 proposals that the Democratic Party has to choose from as it continues to debate this subject. Additionally, the end of what Sanders would get to is a purer version of what government health care can deliver, says Hoffman, adding, hers creates a pathway that is more politically possible, but is still quite hard. Certain tenets of Sanders's version of Medicare for all, like the complete replacement of private health insurance, are currently less popular with Democratic voters who are worried about what such a dramatic shakeup could mean. Harris' approach appears dedicated to assuaging some of these concerns, while sticking to the same end goal. Senator Harris' plan balances idealism and pragmatism, says former Obama Centers for Medicare and Medicaid Services Administrator Andy Slavitt. It says in effect,
Raindrop, drop top, top smoking